when everything started shutting down, I kind of made this post on social media that was like, look, this is why we were telling you guys, you need to sort this stuff out, because
Yeah.
now at this point, we've got this thing that's coming around and it's going to hit people harder if you haven't been taking care of yourself. Like, there's things that you can do to recover in your book, but there's also all of those things that you can do for preventative care. And that's why I love how you approach this. And so on that note, I want to talk about acupuncture in particular and just pretend I know nothing about
Okay.
acupuncture, save that I saw a picture of it and there's a dude on a table and there's a bunch of needles sticking out of him. And I think to myself, okay, I don't like needles, so that doesn't look like any fun at all. I'm not
Hmm.
gonna do that.
This is, this is the number one. I was actually, I was flipping through YouTube and found a TED talk that somebody did who's got a mobile bus in Idaho or Iowa or something, and he does acupuncture out of that. And he said the first question is, "Does it hurt?" And I think that's pretty universal. And we're talking about a very different type of needle, and it's so weird. I almost don't even like talking about the needles because there is this mental component for a lot of people, but the design of these needles, it is not a syringe, right? It's not designed to penetrate the skin, create a pouch to then inject something or pull something out, right? So a syringe comes to a blade. The edge looks like a knife. These needles are designed more like, sometimes they'll call it a pine cone tip, where it's trying to push the tissue out of the way. We're also talking about the average size of a needle being zero point 0.1, let's say 0.18 millimeters wide. So 18 hundredths of a millimeter wide, which is roughly 3 strands of hair. Well, I can't have a reference guide right now, but at one point I did. Within that, it's really meant to go into the tissue with causing the least amount of stimulation, tissue disruption. And what that triggers is a systemic response. In Japan, they call this an artificial splinter, affectionately, right? Something is now in my body, and my body has a response to that. And what is that response? Well, it sends fresh blood to that area. It sends nutrients, oxygen, antibodies, white blood cells, and it goes, okay, well, we're here now. What do we need to repair? Well, this little sterile needle really didn't do any damage, but while we're here, oh, look, these muscles are tight. Oh, well, while we're here, let's like open up the chest. Let's relax the breathing. Let's do all these things with all this fresh blood, extra oxygen, extra nutrients that we have. So it's really a unique system that has multiple functions. This artificial splinter function is only one of them. A big overarching effect that we see, regardless of what we're treating, is regulation of the autonomic nervous system, right? So that this is the idea of getting you out of fight or flight and putting you into rest and digest, right? And as many studies as we have, we see it happening time and time again. We don't know exactly why from a Western standpoint. And the classical explanation is we've smoothed the flow of chi and the body's at rest. And that's the only one that we can really hang on to right now, because we see that switch flip, right? We get out of fight or flight, we go into rest and digest in about 10 to 15 minutes into the acupuncture session.
Okay.
All the blood vessels open up. So now we're getting better blood flow through all the tissue. So whether it's an injury where something's inflamed, we can flush out the cytokines, the inflammatory markers, lactic acid, whatever it is. We get fresh blood in to help repair it. Now, what happens in rest and digest to our gut, right? We're getting more blood flow to the gut. We're picking up more nutrients. We're also reducing inflammation in the gut. We're opening up the chest so we can breathe deeper. Our heart pumps slower, but expands and contracts more. So we're pumping blood more effectively. So we switched ourselves into that repair mode. And then those artificial splinters are there to direct that blood flow where it needs to go. Classically, we have one line that says, where the chi goes, the blood follows. And it's almost like they're copping out. They're saying, like, get blood there and we'll see an improvement, right? So we can't tell the body to, hey, fix this or do that. But what we can do is give it the signals that this area needs attention, or, hey, we need to put you in repair mode so you can deal with this.
That was just about the best explanation of acupuncture that I have ever heard. So thank you for that. I appreciate it. Pain, I would assume, would be the number one reason that people would think about acupuncture.
Yeah.
Is that true? And if so, what are some of the other like benefits or lesser
Yeah.
known things that people use
So
acupuncture for?
certainly when I started out, it was like 80% low back pain. Some days I long for those days because now, like, I had somebody go, I must be the most complicated case you have. And I go, yeah, you're the third most complicated case I've had, and I've only been here 2 hours today. What we end up doing really well with, and this is not curing, this is not fixing. We do well with chronic inflammatory disorders, autoimmune disorders, these things, right? They're very difficult to treat, but what ends up happening is they'll exhaust the entire Western medical system. Oh, the GI guy says it's this, and this person says it's this, and this person says it's this, and it's really their whole system is not in harmony, and it's attacking itself. And there's a bunch of reasons for that. There's genetic reasons, there's exposure, toxicity reasons, there's chronic infection reasons. Um, and Western medicine, if they can't cut it out, if they can't give a drug to knock it down, in these kind of cases, they're kind of at a loss. Now, what we end up doing is we work with a lot of people that are on a lot of meds, but we're trying to help their system regulate better. So, autoimmune disorders is probably the number one thing I'm seeing in my clinic. Now, my clinic sees a lot of mental health stuff, anxiety, depression, generalized stress disorders, PTSD. We're coming into spring, so I know I'm going to have a huge rush of allergy, asthma patients. And physical pain still is up there. I mean, if you look at our clinic, a lot of the stuff we do can really help relieve pain, not just the acupuncture, but cupping's known for that as well. Therapeutic massage, cryotherapy, cold plunges, sauna, red light, all of it helps with pain. But it's really when we're aiming, it's aiming at inflammation. Can we reduce inflammation? Because even autoimmune disorders, a lot of the issues are because the autoimmune disorder is causing inflammation.